Hello everyone and welcome to week number 2. So this week we will be focusing on 2 chapters only. Chapter 26, pages 586 to 593. Chapter 39, pages 886 to 895. So let's go ahead and dive in. Let's take a look at each one of those chapters a little bit more in detail and individually. So chapter 26 is going to start our focus on the eye, or the ophthalmology structure. I want to start with discussing and talking about the eye and its structure and also the diseases that are associated with it, because then it makes it a little bit easier to understand the procedural parts of this. So the eye is a spherical fluid-filled organ composed of structures that facilitate your vision. Those structures are your cornea, pupil, lens, and retina. Now, your nervous system does play a very large role in the sense of your vision. The nerves of your eye help to control the amount of light that's entering into and through the eye, through the pupil. It helps to focus the light on the retina by using the lenses. And it helps to transmit the resulting images from the retina to your brain. So now let's kind of talk about the structure of your eyeball itself. So the eyeball itself is housed in the cavity of the skull called the orbit, or the orbital cavity. The eyeball is divided into 2 cavities, the frontal and the back. The surface of your eye is made up of 3 different layers, as you can see in the picture here. It has an outer layer, or your sclera, your middle layer, which also contains your iris, lens, and cellular body, and the inner layer, which is your retina typically. Beyond that, there are external structures that are associated with your eye. Those structures serve as a way to protect and support your eye. Those include the eyelid, conjunctiva, the lacrimal apparatus, and the intrinsic eye muscles. So your eyelid, as most of us know, closes over your eyeball. It helps to protect the eye from intense light and any foreign objects from entering or impacts. Your conjunctiva is a mucous membrane that lines the underside of your eyelid and the anterior part of your eyeball. The lacrimal apparatus is where your tears are produced, stored, and removed. Alright, so now it's kind of time to discuss some of the more common eye disorders that you will hear of. Some of the big ones are astigmatism, cross-eyed or wall-eyed, myopia, hyperopia, and presbyopia. So let's take a look at each of those. Astigmatism is a condition caused by an irregularity in the curvature of your cornea or your lens. It is characterized by a blurry vision, but it could also have patients being squinting or complaining of frequent headaches, typically around the eyes. In order to treat astigmatism, it's generally with glasses or contacts, but you could also use surgery to help reshape your cornea. Cross-eyed or wall-eyed is when a patient has problems with their depth perception and double vision. Treatment with this will include glasses or contacts. You'll also have a patient wear a patch over the stronger eye to force the weaker one to become stronger, or there could be surgery. Myopia is also called your nearsightedness, and what that means is patients have difficulty seeing items far away. They can see up close, but they cannot see far away. This is treated with glasses or contacts and potentially with surgery, such as like a laser surgery. Hyperopia is also called farsightedness, which means the patients have difficult time seeing things close up. They, again, can see far away, but not close up. And again, most of this is treated with corrective lenses, either glasses or contacts. Now, presbyopia is very similar to that of farsightedness or hyperopia, but typically it's directly related to that of an aging process. So if patients don't have vision problems and as they grow older, they have problems seeing close up, that's called presbyopia. All right, so that's going to finish our discussion on Chapter 26. We're now going to move on to Chapter 39. Now this chapter will discuss the study and the care of the eye. We also know that studies of the eye are called ophthalmology. So the branch of medicine that deals with the structure, function, and diseases of the eye obviously is called ophthalmology. And an ophthalmologist is a medical doctor who can perform exams and surgery, but they can also prescribe medications, glasses, or contacts. An optometrist, on the other hand, is a technician who specializes in the grinding of lenses and preparing glasses or contacts. There are a number of types of different exams that we can use to diagnose and treat vision problems. Most can happen in your primary care office, but such as your routine screenings for vision problems. When you are working with vision exams, the provider will also look at the patient's pupils. So you want to make sure that you're using the acronym PERLA, or P-E-R-R-L-A, which stands for pupils equal, round, reactive to light, and accommodations. You'll also use some other abbreviations such as OD, OS, and OU. OD stands for right eye, OS stands for left eye, and OU stands for both eyes. Now, as a medical assistant or provider that do the visual acuity exams or clarity of vision, you're going to have a few that you're going to look at. The first one is distance acuity. Now, normal vision distance acuity is 20/20. As a medical assistant, you will be responsible for assessing the visual acuity. First one we have to deal with is distance. We'll also have near vision and color vision. So distance acuity is measured by using a Snellen chart. This chart places the largest symbols on the top line, and each line after is decreasing in size. A patient will stand 20 feet away and read each line until they can no longer read them. The result is when the patient receives is when the last line that they can read without any squinting or errors. It will be read as and wrote as a fraction, just like your blood pressures. So for example, if a patient has 20/30 vision, that means that they can read at 20 feet what others would read at 30 feet. For our children, we typically have them stand closer, and that's typically age 5 and younger. They will stand 10 feet away. Next vision acuity test we have is called the near vision test. Doing this test is when patients typically have problems reading or performing tasks up close. This type of test is done using a Jaeger chart, and the patient will read the card held at a normal reading level or distance away from them, which is typically 14 to 16 inches. The card has a series of paragraphs that are decreasing in size. Typically at the top we'll have very tiny ones. Going down they will be larger, and they'll read from the bottom up. The patient's result is the number above the last paragraph that they can easily read without any errors. And the final vision acuity test is the color vision, or Ishihara. This is the test that tests the inability to distinctly differentiate between colors of a spectrum. Defects in color vision are either from birth, or they're born with it, they are inherited, or they're acquired through a disease or an injury. Typically, men have color vision more often than women. We will use a test called the Ishihara test, and it is a printed card book with single color dot illustrations containing a number or curved lines. The patient is shown 14 cards, and they must correctly identify at least 10 of them to be considered having normal color vision. And along with doing vision acuity testing, medical assistants may be responsible for performing eye irrigations or installing eye medications. When you're irrigating the eye, this is when you will rinse the eye to remove any foreign substances, objects, or chemicals. This requires the use of sterile techniques and equipment. You will have the patient either sit or lie down, whatever is easier for them. I typically say that it's easier to have your patient lying down, tilting their head towards the affected side. You want to make sure that the eye that is infected or affected with some sort of chemical is pointing downward, so that when it is irrigated, it does not rinse to the other eye. You will have to open up the patient's eye with your index finger and thumb with your non-dominant hand. You'll use a syringe with sterile water to irrigate the eye in your dominant hand. You will continue this method until a solution is used up or the object has been removed from the patient's eye. When you're installing eye medications, this may be something that a medical assistant will do either in the office, or you'll instruct the patient how to perform this themselves at home. It will be similar to that of the eye irrigation, as the patients will sit or stand with their head tilted back and looking upward. The medical assistant will pull the eyelid down with the non-dominant hand and hold the dropper about an inch or half an inch above the eye and apply the recommended amount of drops or prescribed medication. As you can see in the picture here, they're using an ointment. You want to put it in the bottom lid, and then once it is administered there, you can release and the patient can blink it throughout the entire eyeball itself. Alright, so that is all that I have for the overviews of Chapter 26 and 39. Please make sure that, as always, you are reading your chapters in full so you can be prepared for your lab classes and your discussion posts for the week. For your discussion post this week, we will be discussing 20/20 vision. You will need to do some research on this and discuss if you think that 20/20 is the best vision possible for patients. You will need to discuss if it is bad if a patient cannot see or does not have 20/20 vision. Please remember that your initial discussion post will be due Tuesday nights by midnight. So for this module, it will be October 11th. And you will need to respond to at least one classmate no later than Saturday, October 15th by midnight. As always, if you have any questions or concerns, please reach out to me via email or phone. There is no quiz this week, so just the discussion post and reply post. Have a wonderful week, guys, and let me know if you have any questions. Bye-bye.